Hi, my name is Andrea Borondy Kitts, and I'm here in my role as a patient advocate. And I'm going to talk about the clinician and patient partnership. This came up in a couple of comments earlier today, so I think it's hopefully going to be an interesting discussion. Those are my disclosures. So this is from a patient perspective. When I put myself in the shoes of physicians, and I've been a frequent flyer recently due to my adventures in orthopedic surgery, what are the challenges for the physicians? Obviously time. We always talk about time as being a challenge. We talked earlier about physician implicit bias. I honestly didn't think that was going to be one of the subjects during the earlier part of the conference, but it's there and we need to recognize it's there. And patients know it. They can feel it. They can feel when there's implicit bias. Physician detachment. A person is viewed as their illness. Oh, there comes the right hip I'm doing tomorrow. For example, a lung cancer patient should be viewed as a person with lung cancer. There's a lot more to a person than their illness. There's patient distrust of medical profession, and there's a lot cultural. We know that there's ethnicity and racial concerns as well from the standpoint of additional distrust, and prior bad experiences, either of yourself or knowing someone else who's had a bad experience with a medical professional. And then there's disparate levels of patient activation. So you have someone like me who goes prepared with a 5-page written report with every stat from every day before my last visit, to the patient who doesn't remember if they took their meds or not. And there's disparate levels of health literacy as well. So those are a lot of the challenges for physicians. So how do we get through that? How do we partner together? So this is something that Andy Delau, a fellow patient advocate of mine, put together. And he said, how do I create the ideal patient experience? And he started a project, and he says, basically, we have to have time. You have to have time between the patient and the physician. That time leads to trust on both sides. My physician now trusts me, my surgeon trusts me that he told me, you're a reliable reporter. That was probably the biggest compliment I ever got from him. So he knows that he trusts me now, and I trust him. And we've both been very transparent with each other, and we have to. But you can't have that that transparency without the trust, and you need some time to build that up. And the transparency has to be there to build the trust. And when you have time, it leads to trust, leads to transparency, and that can lead to better transitions, to better health outcomes, and to relationship and success. So the problem is that there's a strong power asymmetry, and that makes the partnership challenging. The reality is that as patients, we all share responsibility for our care, but we've abdicated that. With the paternalistic medical model that's been basically the norm for many, many years, doctor tells you what to do and you're supposed to do it. That's pretty much it. The patient doesn't understand. They don't know that they have a share. They have to share in their health care and their health outcomes. So as physicians, you need to give permission to the patients. You need to invite them in to be partners in their care. Explicitly. Using words like, please join me, be a partner in your care. You want to assess the level of patient activation and health literacy. Not everybody's going to want to make every single decision for themselves, but every single patient will want to be, at some level, know about their care and be considered a part of the team. As patients, we bring our values, our treatment preferences, our symptoms, and we need to bring the truth. Physicians, clinicians, you bring the medical expertise, transparency, and respect for patient preferences. So what are some strategies for engaging with patients? I would say the very first thing I would say, and I know this is going to be hard, but it's really key, is to meet the patient in their street clothes for their first visit, especially if you're going to see them more than once. Spend a few minutes to discuss their work and family situation. Invite the patient into the partnership. And maybe say a few words about yourself and your background. Tell them, I promise I will listen to you. Please listen to me. Shared responsibility once again. I promise I will always be truthful and transparent. I need you to tell me the truth as well so we can have the best outcomes for you. Ask patients to vet information from the web and family and friends with you. Yes, provide them reliable resources if you have it, credible sources, but make sure that they know that, hey, they can bring anything to you and you'll take a look at it and not consider them an annoyance. Ask about their preferences for communication. And once again, language here matters. Patients don't fail treatments. Treatment fails the patients. Patients don't deny drug use. Ask for information on conditions and treatment. Do they want it printed out? Do they web interactive, video, audio? And then find a way to provide it to them. And always include the caregiver as part of the team if the patient brings a caregiver in. I don't know how many of you saw the JAMA article a little ways back, opinion piece on a third option. Did anyone read that? Okay, basically it talked about an elderly gentleman who was close to the end of life, and he was in the hospital, and the family and the physician were all thinking about what the next treatment was for him. Obviously, it was not going to do much. And the patient piped up and said, "I don't want anything." So I thought, wow, that's very powerful. There's always a third opinion. Second opinions are recommended for significant health issues. The most important opinion of all is the third opinion, that of the patient, and it's often not considered. Shared decision-making brings the third opinion. Shared decision-making needs to be the norm, not the outlier. Physician and patient discuss the patient goals and values, treatment preferences given the available options, and the social aspect as well, the social and economic environment. We all know that the social determinants of health basically account for 80% of where we are. So we need to consider that. And at that point, both the physician and the patient, this is a key word, commit to a shared treatment plan. It's not patient compliance or the new word, patient adherence. It's both of them committing to a plan that both of them can live with. It's not very good to give a patient a plan or a medication he's not going to take. I don't know, there was a recent study that showed that something like 30% of prescriptions, when they were written, were thrown into the wastebasket on the way out. We need something that both can commit to. And then transitions in care are really important. And we talked about this a little bit, communication silos. I find, especially when you transition between care teams, things that get lost are allergies, medication, interactions, prior conditions, comorbid conditions, and the EHR just makes it worse. I've done a lot of chart read in the research I do at Lahey Hospital Medical Center, and there's conflicting information between every single physician note. It's quite frankly scary from a patient safety standpoint. And the way to try and get around it is you ask the patient, every single person who sees the patient, ask them the same question. What medications are you taking? What allergies do you have? Your medical history, et cetera. The problem is that I don't remember all that stuff. I actually have a 6-page written document with every single medication, every single condition, my whole family history, et cetera, because I can't remember it. Most patients don't do that. So there's going to be miscommunication and errors and mistakes. I love the idea of a huddle. I would love to see huddles happen at points of care when transitions in care, and I think you could actually probably do a virtual huddle, from the standpoint of when someone is going in for surgery, for example. So when my husband was diagnosed with lung cancer, he was going to be put on a steroid. Well, he had a condition in his eyes where he couldn't take steroids in his eyes. So our oncologist said, well, we probably better check with your eye doctor. Well, we had already called her because we were worried about it, but our oncologist actually did that. So when a patient is going to have something new, what about having a virtual huddle? Do something like that to really, we have to find a way to make it not the responsibility of the patient to repeat the information 10 different times to 10 different people as we go through that. So I think that's really key. And I think really finding a way we can do that with the EHR, with a more functional EHR, should I say, would actually be helpful. We could actually do an EHR huddle. We could call it EHR huddle. I really like that. So this is my last slide, and I purposely ended this with a tweet. So that's basically what patients want from their provider. I've already told you all of that. The reality is that there are many communities on Twitter, and I'm just going to talk about Twitter because that's the one that I found most effective and most powerful in the healthcare environment. I would say these communities would actually are supportive of not only patients, but of researchers, clinicians. I'm part of a lung cancer community, and I have seen this community, it's called Lung Cancer Social Media. We tweet under that hashtag, and it was started back in July of 2013. And I became a member, I started tweeting shortly after that. And I have seen the evolution of how some of the clinicians and the researchers in that community have actually found, and I'm going to say this, joy in their practice, more joy, because of the input and the interaction between all of the stakeholders in the community, including the patients. And I can't tell you how many of those clinicians have now met the patients, have gone to conferences, have gone to places where the patient advocates are, and have teamed with them to go out. So I would encourage all of us, despite the comment earlier today, to actually consider social media. And I would be happy to help anyone and talk to anyone to do that. Thank you.